The last part of your labour is known as the third stage, and it is the birth of your placenta. If you have had any intervention in your labour, if you have required an induction, or if you have needed an epidural, or if you've needed assistance birthing your baby, it will be recommended that you have an injection to help with the birth of the placenta. This is to get it out more quickly, which in turn reduces the likelihood of mum bleeding heavily after all the interventions that she has had. If you haven't required any assistance or intervention, however, then you can decide whether you'd like to have that injection or whether you would prefer just to wait for your placenta to come out by itself, which it will, sometimes soon after the baby is born and sometimes an hour or so after the baby is born. But you will still be having some contractions, and on one of those you'll feel like pushing the placenta out. Regardless of whether you choose the injection or decline it or don't need it, the important thing to think about with the last bit of your labour is giving your baby sufficient blood into its system. So this is done by allowing the cord to finish pulsating before it is clamped and cut. The placenta is still sending blood into your baby's system even after it has been born, and this helps your baby to make the transition from life inside to life outside and air breathing rather than receiving its oxygen through the blood. It will still receive that oxygenated blood via the placenta, via the umbilical cord, but it will just have that as a backup to learning how to breathe in the air. So it only needs to be a few minutes, maybe 5 or 10 or 15 minutes of waiting, and it's very clear visibly when the cord has finished pulsating, because it goes from being thick and blue to being thin and white and floppy. So it's easy for the midwife to see when that process has finished. Dad can still cut the cord if he wants to, or the midwife can do it if you'd prefer. So the key is to allow that cord to finish pulsating, just to give it the time that it needs. It will be different for every baby, and if you've had a cesarean, it is often still possible to wait even just 2 or 3 minutes and allow your baby to get the majority of the blood into its system.